Hello, I'm Erika Clark-Jones, CEO for the Alcohol, Drug, and Mental Health Board of Franklin County. Thank you for joining us for our 2021 annual meeting and our second virtual gathering for this occasion. Congratulations to this year's award recipients. I'm honored to recognize your service. And thank you to the dozens of ADAMH providers for your continued resolve to manage and adapt to changing circumstances. This past year has been one of resilience, yet also one of opportunity. The demand for accessible behavioral health care is strong, and the providers that fuel the ADAMH network of care continue to respond. For example, the Peer Center's Warm Line proved to be such an invaluable resource during the pandemic that the center recently expanded their capacity to ensure that persons with lived experience are available to support community members during these times of great need. To help combat opioid overdose deaths, more than 5,000 additional doses of naloxone were distributed in Franklin County's hardest hit zip codes in partnership with 8 ADAMH provider agencies, including North Community Counseling Centers, Comp Drug, Ohio Guidestone, Columbus Public Health, Community for New Direction, Maryhaven, and Southeast Healthcare. The Buckeye Ranch launched an LGBTQ+ anti-stigma campaign, including resources for LGBTQ+ youth, family and caregivers, educators, and allies. To address the need for additional capacity for substance use disorder treatment and transitional support for individuals with justice involvement, Alvis recently broke ground on a $25 million expansion at the existing Alum Creek facility. This year has also been one of recommitment to our mission, our community, to the people served by the ADAMH network, and to the more than 30 community-based providers who make up the ADAMH system of care. Franklin County ADAMH has a renewed and expanded investment in our network, thanks to you, with the passage of a 5-year countywide property tax levy. Coupled with the increased community behavioral health care needs intensified by the pandemic, there is no better time to redefine our path forward. ADAMH is grateful for the significant support for our community-based behavioral health safety net. This support comes with responsibility to ensure that ADAMH remains a good steward of taxpayer dollars. Nearly 70% of our 2020 budget was funded through levy dollars. These funds support vital mental health and addiction services and supports delivered through a network of more than 30 community-based provider partners. As our board chair, Nathan Weimer, mentioned, we have spent much of the last year looking at how ADAMH can better deliver on its mission. Through organizational and county community assessments, we identified many opportunities to enhance the network and its 6 systems of care. Informed by that input, we have a strategic roadmap for the next 5 years to align with the new levy cycle. As a network, we are at our best for our community when we hold ourselves accountable to common outcomes and proven measures of success. This means working with each of our partners to monitor and achieve high standards that result in lower suicides and reduced overdose deaths in Franklin County. Our data supports ADAMH's focus on equity and access across our behavioral health system, and we will accomplish this through innovation and collaboration. Some of the most visible work in service delivery over the next year will be our efforts to enhance the continuum of crisis care. Mental health crises are health issues, and whenever possible, should be responded to by behavioral health professionals when there is no threat to safety or a medical emergency. We continue to work with public safety and community partners who agree that this approach should be guided by delivering the most appropriate response for an individual situation. Most importantly, we want to understand and support providers' needs so that they successfully serve our clients across all 6 systems of care. Our network is only as strong as each provider's ability to attract and retain a qualified, diverse workforce. There is an additional opportunity for ADAMH to provide more direct support in this area. to enhance the pipeline of behavioral health professionals as well as help providers keep their talented employees. Among the strategies we are exploring is funding assistance for securing and attaining professional certifications. ADAMH will also look at ways to address the competition for talent. Finally, as we recommit to being good stewards of public dollars, we must understand and measure the impact of our investments in a new way. To answer the questions, how much did we do? How well did we do it? And are clients better off as a result? For this, data is critical. Better data collection, analysis, and reporting of local ADAMH investments, including who we serve and who we are missing, must be known. This information will be a powerful tool in helping us fund more of what is working, improve what is not working as planned, and identify opportunities where there are gaps. Because at our core, our business is about helping people thrive. As the largest ADAMH board in Ohio, we are uniquely positioned to lead the way to increasing accessible, equitable, community-based mental health and addiction services and supports. There is power in the ADAMH network. To the more than 30 agencies, all working towards common goals to improve mental health and addiction outcomes in Franklin County, thank you. Together, we are ADAMH, where better begins for so many of our neighbors and friends. Thank you for joining us.